Welcome to another Yorkshire Dental Suite vlog. I'm here with the main guy from Manchester, Dr. Phil. What's going on today?
How's it going? We've got some big treatments in today. We're going to be doing a nice big smile makeover for a lovely patient of ours. Really excited to get her going, and she's going to be absolutely buzzing after this result. So let's do this.
Thanks for tuning into another vlog. It's going to be an action-packed, exciting day. Stay tuned. And as always, guys, make sure to like this video and subscribe.
Good morning. My name is Dr. Nigel. My part here at Yorkshire Dental Suite is that of dental implants and restorative dentistry. We've got a bit of a mixed bag today. We've not got any surgical work in today. It's a day of restorative work, which means this is where we're tending to do the top bits that go on dental implants. We've got some denture cases in, we've got some crown and bridge cases in, some crown preparations. So today is a bit of a mixed bag from a restorative point of view. So we'll probably see you at several stages through the day and update you and show you what we're doing.
So we just had Stuart in and we saw him for his teeth whitening review, and we've got a great result, really bright white teeth now, and we wanted to move on to the next stage for him, which was going to be aligning his teeth. Stuart went to see one of these other companies that can provide you with aligners directly without the supervision of a dentist. So we had a really good discussion about it, and we spoke about the fact that without the supervision of a dentist it can be unsafe, because we need to make sure that the teeth are healthy, we need to make sure that everything's in the right condition for us to then align your teeth, because otherwise we can end up with problems along the way. So I made sure that Stuart was really aware of this, because if we're going to do it, we want to make sure we do it in the best way possible, and that's what we're going to do for Stuart.
Hi guys, so we've got the beautiful Charlotte here today, and as you can see we actually have got the aligners in right now, if you look up super close, and we're on the 11th aligner today for Charlotte, and we're just towards the end now because we've got 14 in total. So super exciting stuff. How's the journey been for you so far?
Absolutely amazing. It's the best thing I've ever done, 100%.
Amazing. Your teeth are looking amazing already, and how far forward your front teeth are coming in, and so it's looking a lot better.
Definitely amazing,
really
thank you.
You're welcome. And so today's appointment is all about kind of creating a little bit more space between the teeth now to help the teeth move into line, something called IPR or interproximal reduction. So that's what we've done today, and how was that for you?
Amazing, I can't feel a thing, and it's super quick as well. So, yeah, really good.
100%. So a lot of people are a bit worried about IPR because it uses a drill and it's like water and it's like dentistry obviously, so it can make people feel a bit nervous about what to expect, but generally it's just a bit of water. You shouldn't be feeling anything. Would you say you felt anything during that procedure?
Nothing. I wouldn't know what's going on.
Amazing, that's what we love. And then we've done the IPR now, so the gaps are ready for us to go, and then we've just got the last 3 aligners left before we finish, and then we'll get Charlotte back in 3 weeks and assess the final tooth alignments. Yeah, super excited to see the results.
Definitely, thank you.
You're welcome.
This is the real drama in Dr. Rajan's life, trying to get
Honestly,
the flashes to work.
I've struggled with this for nearly, 6 months now? Just waiting for stuff to become in stock. But I will resolve this engineering nightmare.
Hi, I'm Claire Louise, and I am the lead dental hygienist here at the Yorkshire Dental Suite. So a dental hygienist is the prevention drivers in the practice. We don't want you to need treatment, so we want you to prevent the need for treatment. We're going to work with you to make sure you prevent tooth decay. We're going to work with you to make sure you prevent gum disease as well. But if you do have gum disease, we also work with patients to prevent gum disease getting worse and leading to tooth loss, because some forms of gum disease can lead to losing your teeth later on down the line. So we help you by treating that and working with you to stabilise it. We also do cosmetic treatments as well. So as a byproduct of our treatment, we get rid of tooth stain, and this can make your teeth look very white and fresh and a great smile, but also we do tooth whitening too. So we work with you to get a whiter smile. Your first appointment with me will be the longest one because there's a lot more to discuss, there's a lot more to go through, and the treatment will take a little bit longer as well. At your next appointment, we hopefully have got you into a maintenance phase. So this is where treatment doesn't take quite as long because we're maintaining it. So appointments then, the time does come down a little bit. And then my superstar patients, the ones that are going away doing all the things that I tell them to do, and they're absolutely amazing, the appointments then become very, very quick and easy because effectively you're doing all the hard work at home. I'm just helping you to maintain that. So first appointments are always the longest, and then as we go through the maintenance appointments and we become stable, then appointment times do become a lot quicker, and seeing me is an absolute walk in the park. So what happens in treatment? Let me show you. So I hope that gives you a little bit more of an insight into what I do in your appointments. Remember, the equipment that we're using is very high tech, which means that it's been designed to make it as comfortable as possible for you. We warm the water up to 40 degrees so it's nice and comfortable. The powders that we use are really, really fine particle powders. We can use that on the tongue, we can use it all around the mouth, on the gums. It gets below the gum line, above the gum line, cleans away staining really effectively as well. So deep clean, very efficient, very effective. And so, yeah, I mean, everything that I do technique-wise, the time that I take and the equipment that I use is all designed to make sure it's a comfortable, enjoyable experience to see me. So, yeah, I hope to see you soon.
Hi guys, so next we've got Rebecca, and today we're going to be doing her debond, which is essentially the last stage of the Invisalign treatment. So Rebecca's gone through about 14 weeks of Invisalign to straighten up the smile, and today, assuming we're all happy with the alignment of the teeth, we'll be taking off the attachments, getting started with the whitening, and then we'll be taking some scans today and photos for something called a trial smile. And basically the trial smile is an opportunity to be able to see the design of the teeth when we actually go on to the porcelain veneers, which is the next stage of the plan for Rebecca, and we'll be veneering the front 4 teeth for her across the top 4 teeth. So yeah, these are the steps we'll be taking today, and look forward to sharing the journey with you in a moment.
So we've just had Karen in for her consultation, and I thought it would be an interesting one to discuss because it's not just a case of aligning, bleaching and doing some composite bonding for this patient. We had to think about planning the case a little bit more in detail. So for her, we did need to straighten the teeth first. So she was concerned about one of her teeth that has kicked out, and the front teeth are a little bit folded back. So really we needed to focus on aligning the teeth first and getting them in a better position. From there, she also had some discoloured fillings that we would want to replace once we do some whitening. We've got a dark tooth which was dead essentially, so that tooth needs to be whitened from the inside out. And then also a crown where it's a bit of an old crown and there's been a little bit of recession, so we need to produce a new crown which is going to fit next to the gum better and it's going to look a little bit more aesthetic. So after that, once we've got all of that sorted out, then we can go on to looking at filling the spaces for this patient, which was a big concern of hers. And so that's why here at Yorkshire Dental Suite we can do the best for our patients, because we can work as a team and at the end get the implant dentist in, Dr. Dalgoose or Dr. Nigel, to have a look at those spaces and fill them to finish off the smile.
Hi everyone, welcome back to our YouTube channel. Here with Dr. Nigel, we'll be just giving a few quick questions. Reporting live from YDS, second floor. Quick 5 questions. What's your favourite nurse? No, you're asking him, not me. Who's your favourite nurse?
Yes.
Which is your favourite tooth?
What was intuitizer?
Oh, really nice.
It's not very quick fire, is it?
Hi, welcome back. This is quite an interesting case, and it's probably a good example of cases done abroad. We see a lot of work that's done in different parts of Europe and different parts of the world, come to that. Very mixed, some good, some bad. The biggest difficulty we get is a good example here that we don't actually know what the implant systems are. This guy had 6 upper implants and 4 lower implants placed pre-pandemic in Turkey, with the full intention of going back for them restoring with final bridge work 3 to 4 months later. Obviously the pandemic hit. He's not been able to get back out there, doesn't really want to go back out there, and so has asked us if we'll do the final restorations for him now. The difficulty is we don't know what the implant systems are. We managed to get in touch with his clinic in Turkey. They've been really helpful. The implant system is a Swiss system, so we've been in touch with the implant companies. Export is very slow. We're finding this with lots of dental implant components at the moment. So we are getting there, but it's taking a lot of work, and it's probably a good example as to why, although it's a lot cheaper abroad, thinking twice before you venture abroad. If there's any issues with the work or there's any problems with the work, it's quite difficult for us to sometimes get hold of that particular system, because all dental implant systems are different. It's not a standard universal system worldwide. So getting hold of these can be a problem. We've had another case from Turkey, and they quite simply don't distribute into the UK. So we've had to say to this guy, I'm sorry, we can't do anything. So that's something worth bearing in mind if you're thinking about having work done abroad, to think twice, because if anything goes wrong or you need remedial work done in this country, we can't always get the parts to be able to correct it.
So I hope you've enjoyed today's vlog. Don't forget to subscribe and like the video, and follow us at Yorkshire Dental Suite on Instagram for more amazing content.